Good evening, Barbadians, and to all others who are joining this broadcast. We are coming to you from Ilara Court in another of the series of press conferences intended to keep Barbadians abreast of what is happening in the island in relation to COVID-19. Here to join us this evening to make a number of major policy announcements is Lieutenant Colonel the Honorable Jeffrey Bostic, Minister of Health and Wellness. With him is the Minister of Home Affairs, the Honorable Wilfred Abrams, who will speak about the very large cluster that we had at Her Majesty's Prison Dodds, and to give us sound technical information and guidance, and to indicate what our nationals and persons on island, what our stakeholders are supposed to do in the context of the information being given this evening and in the context of a COVID-19 outbreak, are Dr. Anton Best, who is a public health specialist with the Ministry of Health and Wellness, and Dr. Carl Ward, who is the Medical Officer of Health at the Glebe Polyclinic. Dr. Best will speak to us on a number of issues relative to what happens in a business place or what should happen if an employee tests positive. He will guide families on how they should behave and interact in the context of the home in order to keep themselves safe. And he will tell employees, what do you do in your workplace if one of your colleagues tests positive? Does it mean that you stop work? Does it mean that the place shuts down? We've heard a lot about contact tracing. We're not necessarily clear on what it is, and that is where Dr. Ward would come in. And as I indicated, the ministers are going to give us major policy announcements. Now, this press conference this evening is one in a promised series. And I just want to explain to you that this is an evolving and dynamic situation in which things are changing very rapidly. And therefore, while our ideal schedule is Tuesdays, Thursdays, and Saturdays, from time to time, we will have to change that. Today, we are keeping to schedule because there is actually a major announcement or some major policy decision that is going to be shared with the public. So welcome. I'm happy to be joining you finally out of quarantine and to have with me this evening persons who can help to guide Barbadians and to support us through this very difficult time given the spread of COVID-19. My first speaker this evening is the Honorable Wilfred Abrams, who, as I indicated, will speak to the very large cluster that we had at the prison. Really well over 300 people, 350 or thereabout, but I believe that he's going to let us know what is happening with that. Minister Abrams, we're happy to hear you, sir. Welcome, and tell us what is happening, please.
Thank you very much, Ambassador. Good evening, Barbados. Let me start by expressing my thanks to the prison staff, the Barbados Defence Force, the Commissioner of Police, and the members of the Royal Barbados Police Force who have assisted tremendously, as well as representatives from the Ministry of Health, in helping us to manage what was a very testing and trying situation at Her Majesty's Prison Dodds. I want to commend those from the Ministry of Health and those who were on site with our isolation care facility who have provided excellent care and helped us to manage a very, very trying situation. While we may have had some issues with the testing and the results, getting results of the tests, my confidence in Barbados' healthcare system was never shaken. And I keep telling people that we might have been overwhelmed with our testing, but at no point in time was our healthcare system overwhelmed. And I had full confidence that Barbados was in a position to deal with anything that might be thrown at us. I'll bring this narrow this now down to the prison and the particular prison setting. As everyone knows, we had a cluster of over 300 persons in the prison, which comprise prison officers and comprise civilian staff and also inmates at Her Majesty's Prison Dodds. And because of the closed nature of a prison system, things spread very quickly in the prison system. So anytime you have a medical outbreak anywhere in the world, you look for it and monitor your prison system to see when it turns up in the prison system, because all must be done to try to control it. Now, we spent a very trying time of almost a month trying to manage the situation at the prison, balance the rights and the healthcare of the inmates with the healthcare and concern for the prison officers and the civilian staff and the wider Barbadian public. So a lot went into the prison situation, and it was not an easy task. What I am pleased to say is that we're making significant progress, or we have made significant progress in the prison. Whereas we tested over, or we had over 300 confirmed results in the prison, I think we are now down to a very, very small amount. It just shows how fluid the situation is. Had this press conference been had this morning, I would probably have said to you that we had nobody who was being monitored as a COVID positive in Her Majesty's Prison, Dodds. All who were in the quarantine section, having completed their 14 days of quarantine, would have been cleared. We had persons who were eligible for release, and a lot of people kept calling and asking about them and their rights, including attorneys. And those who have been scheduled for release up to this date, I believe the last person who was scheduled up to this date would have gone home today. There was one female inmate from the women's prison who was released previously as well. So we are now on top of that. We have one other person who's already been cleared for release, but they're not due to be released until the 28th. So some level of normalcy is returning to the prison. People have been calling, asking about how to put money on their loved ones' accounts so that they can get calls out or access things from the commissary. Then JS put out a release this week which advised that it was available through the M-Money platform. We're going to circulate that again. I don't want to go into details of all of that, but provisions have been put in place that you can credit your loved one's account or any inmate's account with funds to allow them to carry out their normal tasks. The one challenge that we have had and we continue to have is the sick leave from prison officers in the system. So people keep asking when we're going to return to the virtual visits. We'll return to the virtual visits as soon as we are in a position to. Right now, I'm just going to run through some figures just to give you an idea of the overall position at the prison. And these figures, I try to keep it as simple as possible just to give you a snapshot. And I guess I can address any other anomalies in the questions as they come up later. So far, out of those who have been quarantined, prison officers, a total of 147 prison officers have reported back to duty. Of the set who was initially in the prison during the lockdown, all but 10, I believe, have gotten their results. Some would have tested positive, and Dr. Ward will probably give you the figures on that. Most would have been released and are free to resume their normal duties. We've given everybody who was in that situation a couple of days off home with their family, and I think the first one is due to report either tomorrow or on Monday to be reintegrated into the shift system at Dodds. The phone calls for inmates have been restored, and as I said, the JS has informed that the M-Money platform for crediting the inmates' phone accounts is now active. 5 previously positive persons who have gone through 14 days quarantine were released today. Some inmates were allowed as well outside to enjoy exercise in a controlled manner because, as I said, the prison being what it is, although our numbers have come down drastically, our positives have come down drastically, we have to be mindful that because the situation is what it is, if we are not on top of our game, it can flare up again, similar to the situation in Barbados generally. So we are trying to keep everybody in terms of exercising and whatnot within their quads, so that if we do have a flare up or something else happens in the prison, it can be confined or isolated to sections as opposed to the general population. We have had no critical COVID incidents to date. We had 2 COVID-related cases that were referred to the medical isolation facility, and they were released without complications by the medical personnel at the prison. Our sanitization program is going well, and so far no one that has returned to the prison, none of the prison officers who have returned to the prison have tested positive. So I wish to commend all of those who are keeping on top of that. And I want to commend the selfless, courageous action by those who have returned to their duties and their responsibilities, either from quarantine or in some cases isolation. We have inmates who were we had prison officers who were isolated at the Harrison Point facility who have reported back for duty, and that speaks to a tremendous commitment on their part and commitment to national service. Over the coming week, we expect more normalization of the operations at Dodds, and we have been using rapid tests as well at the prison where circumstances warrant. So this will assist in early detection and help us to manage the prison healthcare system. So the rapid test, as I said, we had this press conference this morning. Based on the information in front of me at the time, I would have been reporting to you that we had no positive tests, no positive cases at the prison. We have gone through as well. We keep monitoring the inmates for symptoms and doing tests where warranted or where medical information suggests that tests should be done. We have started using the rapid testing system, and the rapid testing system today was able to pick up 3 persons that we suspected were positive, and we've now confirmed that they're positive, and we're able to isolate them and those around them in an effort to control what is going on there. Dr. Ward can possibly speak to you about the herd immunity concept, but basically the risk at the prison is coming down, and is coming down drastically. So we currently have 99 prison officers on sick leave, and I wish them a very speedy return to health, and so that they can resume their duties. And for the 13 prison officers who are currently in isolation, my best wishes go to you and your families who are concerned. And I'm praying for you constantly, and I ask the rest of Barbados to join with me so we can get all of our frontline workers back to good health, that we can have families reunited, and that we can even further reduce the numbers that we use to report from Her Majesty's Prison Dodds. So on the whole, the situation at Dodds is significantly better than when I last had cause to report to you on the situation at Dodds. We have been managing as well the concerns of relatives and loved ones who have been calling asking for information. We've been facilitating contact between inmates and their attorneys in urgent situations. The situation is not ideal, it is not fully normalized, but I can tell you that we're doing the best under exceedingly trying circumstances, and it is a testimony to what can happen when you manage a situation well and you follow the protocols that are set down. So I wish to commend all of those who played a part in helping us to drastically reduce the numbers at Dodds and help us to bring the situation well not under complete control, as in 0 positives, to 100% of a better situation that we had 1 week ago. Thank you.
Thank you very much, Minister. I'm sure that there are going to be some questions from your presentation. Let me apologize for not joining you at the prison last week, Friday. As you know, I was still very much in quarantine and really could not be there with you, but I know that it did create quite a tremendous amount of interest, and I received myself many calls from the relatives or attorneys for prisoners asking about details of their well-being. So this report to the nation and to families who have inmates at Dodds is really quite an important one. We move now to Minister Bostic, Minister of Health and Wellness, who has been telling the country over and over all through the COVID situation from the date of our very first case, that the important thing for all Barbadians is to wear their masks, sanitize their hands or wash frequently with soap and water, and physical distance or social distance, as some people say. 6 feet is now the recommended distance. So let's do that. Let's try to beat back COVID, Barbados, by doing the right thing, all of us. Minister Bostic, I look forward to hearing you this evening to give us an update on the situation with COVID-19 relative to the numbers, as well as to hear what I'm told are some important new policy announcements. Thank you so much for being with us. I'm just going to clear the podium so that you can join.
Good evening, everyone. I'm here once again to share as much as I possibly can with you. And before I do that, I think I would take this opportunity now that I have Minister Abrams here with me to really convey to the Minister and to the entire team at Her Majesty's Prison from the Ministry of Health and Wellness our gratitude for the outstanding effort that has been done there at the prison over the last several weeks in what obviously were some very, very difficult circumstances. As a person who has worn uniform for over 3 decades, I know what it is to represent a uniform. And so I say to those prison officers in particular, you've been through the fire, but you must continue to wear your uniforms with pride. And I ask all Barbadians to join me in showing some love, some support, some encouragement for the officers of Her Majesty's Prison Service because they deserve it at this time. Now, let me give you some statistics that I'm releasing today. And I will say to you that for the 21st of January, 1,593 tests were done at the Best dos Santos lab. And those tests have yielded another 72 positive cases, 47 male and 25 female. Of the 72 new positive cases, 5 are from Her Majesty's Prison, 2 male, 3 female staff members. A number of new cases are persons who would have been sent to Harrison Point previously for assessment, and those persons were confirmed to be positive. Of the 58 other cases, there were 34 identified as Barbadians through their identification cards, 5 non-Barbadians, and 19 unknown at this time. Contact tracing will reveal additional information. 25 persons will be released today from our isolation facilities. I want to speak to you today not only about numbers, but I want to have a discussion with you to tell you exactly where we are and based on our analysis, what is happening out there and where we intend to go from here. The current outbreak, you would recall, was recognized on about the 30th or 31st of December of 2020. That is when the first positive cases were identified. Since then, through the lab, we have had some 1,035 persons who were added in terms of positive cases. And most of those cases would have come from Barbadians living in Barbados who would have contracted the virus from other positive cases. Cases are spread across the country and many physical and other communities, including work and leisure. So far from the information which we've been able to analyze, the main clusters that we would have outlined, there has not been movement in many of those clusters in terms of additional cases being allocated. However, some of the clusters have had some additions. The West Coast cluster, for example, has had an additional 2 positive cases, bringing the number to 133 positive cases from that cluster. The West Coast bars, hotels, and businesses, which we would have been speaking to before under another heading, they have added another 14 positive cases, bringing their total to 77. The bus crawl has an additional 18 positives, bringing their numbers to 45. As I said before, all other clusters remain unchanged. Now, what we are learning from the analysis that we have conducted as a result of contact tracing reports is that most of the cases, and most of our positive cases I'm talking about, outside of the initial outbreak, are not coming from associated institutions, that is, institutions, business places where you might have had a positive case. But what we are seeing is that families of positive cases, that is where we are seeing the issues. So what does that tell us? It tells us a number of things. Firstly, that the majority of our cases are coming in environments where people would naturally tend to drop their guard. Drop their guard in families, drop their guard in community settings, and so on. It is also evident that the protocols that have been enforced at the majority, the vast majority of business places have held together and has caused a reduction in what one would have anticipated as cases coming from those entities. And I think that that is a very important thing, because we all hear about protocols, and one would think that there have been breaches of all of the protocols, which is not the case. The protocols are actually holding, and because the protocols are holding, that is why we are not seeing a lot of positive cases coming from contacts of those persons who would have visited various business places and so on. So that, to some extent, is indeed a good sign. The increase in the cases, as I said, we recognize that the cases are set all over the country, for the most part, the southern part of the country and along the west coast, and this is consistent with where some of those clusters have developed. We would have also said to you before that using the WHO definition of community transmission or community spread, that we did not consider, and the public health officials did not consider at the time, that we were at that stage in terms of the pandemic. And so we were working based on what we were seeing, but continuing to do a lot of work across the various communities in Barbados where these cases were springing up, in clusters or not. And that is how we have been tackling the situation. But within the last few days, I must say that after greater analysis and in consultation with the medical professionals who've been doing the contact tracing and those in the Ministry of Health and Wellness, the medical professionals have advised that based on two factors. One, some of the cases that we were following from the beginning, from the initial stages of this current outbreak, we still have been unable to link those cases, some of those cases, to any of the existing clusters or to any previous positives. And that is because we've been trying desperately, and we didn't want, it is not that we put cases into clusters for the sake of doing so. It has to do with where the contact tracing leads us. And so some of those cases up to this point in time have not yet been determined. But we are also seeing some other cases that are coming up, some new cases. And the important thing for us right now is to focus on new cases, and we will continue the contact tracing with the others, but in terms of linkages, for those cases where we have exhausted our efforts in terms of finding a link, we know, based on the public health officials reporting, we have reached the stage where we believe and we are declaring that there is community transmission in Barbados. This is a situation which we have discussed with the Pan American Health Organization, and we have informed them of our decision to do so. Community spread or community transition. Of course, you will recall all of the things that we've been discussing with you. And the determining factor in the definition that is used by WHO and all international agencies is the inability to link a particular case to a contact, a previous contact. That is the determining thing in terms of community spread. And because that is where we are at this point in time, unable to link some of our cases, we have determined that Barbados has community transmission or community spread of COVID-19. Now, what does that mean for us? We have been working assiduously to deal with all of the positive cases that we've had and all of the contacts. And we have already started to put measures in place to deal with what we are facing. When we started out on this mission about a month ago, last year, we planned for all eventualities. And the plan that we had envisaged something like this occurring. And so that is why we had stood up Blackman Gollop, because that was part of the plan. And there are additional facilities that we can stand up if necessary. So our strategy at the moment is trying to find persons that we consider to have been exposed to known positive cases, continue to assess them, place them in quarantine, and to test all primary contacts. And this will continue, but with some intensification in places of greatest interest. Additional resources from within the Ministry of Health and Wellness will be allocated to the contact tracing effort. We have started to use a WHO-approved antigen rapid test to assist with screening at hospitals, and also an initial test for primary contacts. We met this morning with members of the Council of the Barbados Association of Medical Practitioners in order to discuss the integration of the private sector doctors and clinics in the testing of persons using the antigen rapid test. Additionally, an all-out effort to identify and locate symptomatic persons within communities will be initiated as a matter of urgency. This is vitally important because our greatest desire has always been and will continue to be to save lives. Assessing the level of transmission is key to assessing the overall COVID-19 situation in Barbados, and therefore, guiding essential decisions on response activities and tailoring epidemic control measures, those are of great importance to us. So that based on the WHO proposal that we consider in assessing the intensity of transmission, we're looking at the hospitalization rate, which remains low still, mortality rate, which remains low still, case incidence and testing capacity. And we have increased that capacity numerically, or in terms of human resources, in terms of equipment, and also by now introducing the use of the antigen rapid test to help us with contact tracing and to help us with screening within the hospitals. So we are experiencing, therefore, from low to moderate community incidents or risk of community transmission beyond clusters. Additional measures may be required to control transmission. However, disruptions to social and economic activities can still be limited. And as the Prime Minister would have indicated previously, we have a commitment to tighten up on the restrictions if necessary, and those will be discussed over the coming days because the Prime Minister also has a commitment to discuss such matters with wider social partnership. We are building to ensure adequate health system capacities, that they should be in place to detect and to test and to manage new cases. And the focus, of course, has to be also managing new cases in order to get to those primary contacts to stop the rate of spread within the country. The risk of outbreaks in settings within vulnerable individuals should also be minimized. And what we are recognizing, as I said, is that we are getting some spreads in some families. In some cases, we've seen as many as 9 persons, 12 persons from one family because of exposure to a contact. And this is something that we would have to try desperately to see if we can resolve. So, what we are doing then requires identifying all of the major drivers of COVID-19 transmission. Example is the various types of closed settings in Barbados with the appropriate measures in place to maximize physical distancing and minimize the risks of new outbreaks. We will also investigate additional measures and put in place to reduce the risk of infection and transmission and outbreaks in settings such as care homes. We will focus on prevention and early detection of potential super spreading events, and by doing that, we believe that that will be one way of also halting or delaying the rate of transmission. We intend to work in collaboration and in consultation with relevant stakeholders from government, civil society, and community groups. All of the interventions that I've mentioned will include, at a minimum, behavioral objectives and target audiences, because that, for us, is also vitally important. So what I'm saying here, Barbadians, residents, and visitors, is that we have a challenge on our hands, and we knew this. But it's a challenge that we still have capacity to be able to deal with. We started out over a year ago by saying that it has to be an all-of-society approach in order to help us to be able to wrestle with the problem. We have planned for this eventuality, hoping it would never occur, and that is why the plan has various layers to it. And the plan in relation to community transmission is one that we have started to activate without even recognizing community transmission, and that is because the density of some of the areas that we've had to deal with and the cases that we've had to deal with in several areas and the way they were emerging, springing up, we knew that we had to put a number of things in place so that we can deal with the surge. The situation is not one for panic. The situation is one for all of us, civil society, all of us to come together and to try collectively to resolve the issues and to stop the spread. At the end of the day, I maintain that it is up to each and every one of us to do our part, to wear the mask. And I know what I'm talking about because I drive around too like everyone else. I visit various establishments. And all I'm saying to people, if you have a business, even if it is a village shop, a village mini mart, it doesn't matter, a bakery, and persons are coming into your establishment who are not wearing masks, do not allow them in. Do not entertain them. Send them back out, tell them to come in wearing a mask. Sanitization of hands, very, very important. And I say this, and I will say this with pride. There's only one way that I know of in terms of dealing with something that is challenging, that looks like an uphill climb, and that is to fight. That is what I've been doing all of my life, and I ask you to join me. No surrender, no retreat. In good times and in bad times, together we can fight through this. We can overcome. I thank you.
Thank you very much, Minister. We will turn now to Dr. Carl Ward, who is a medical officer of health at the Glebe Polyclinic, and he is very much engaged in the process of contact tracing. Now, we hear a lot about it, contact tracing, getting primary contacts, secondary contacts, tertiary contacts, but what really is it? How complicated is it? What happens? How reliable is it? Dr. Ward, we should very much like to hear from you on this whole matter of contact tracing, particularly now that the minister has told us that we have community spread.
All right, thank you very much, Ambassador Thompson, for the opportunity to explain contact tracing. Incidentally, what you said there pretty much explains most of it. So contact tracing is the process by which during an outbreak of anything, public health teams or officials, doctors, nurses, health inspectors, basically start to interview the ill person or the person with the condition and start to get from them what we call a contact trace. So first of all, you try to get their contacts, who have you been around and so on. And then you try to give a trace. So the trace time or duration depends on the illness you're dealing with. If you have an illness that has an incubation period of 2 days or something like that, then you don't have to necessarily trace too far. Some illnesses have much longer incubation periods, and they would require what we call a much longer trace. In theory, or at least just in the basics, contact tracing can be easy when you think of it, but it also can be difficult and challenging, and requires you to ask questions multiple different ways, and requires you to find ways to jog people's memories. So what we would do, first of all, if somebody is positive, the first thing that occurs is what's called a notification. So someone from the Ministry of Health would call the person whose result has come up as positive and let them know basically that they are positive, and then refer that person so that the person can be transported to isolation. At that point, some basic contact tracing information is gathered. Who's in the house, where they work, phone numbers, and so on. Sometimes the person doing the notifying is also the person's contact tracer. Sometimes the person doing the notifying is just doing the notifying and then handing over the case to somebody to actually contact trace. The contact tracing is normally done by the medical officer of health on their team from the catchment that person lives in, unless the person is already obviously part of a cluster, and you might have a team or an individual doing the tracing for a cluster. And if that is the case, then you might get someone doing the tracing who's not from that area. So the tracing starts off with basic demographic stuff, name, age, that sort of stuff. Again, you're trying to make sure that the person you're talking to is indeed the person with the positive result. And then you get an idea as to who's in the household, who their primary contacts are. And what is a primary contact? A primary contact is someone who has been in close contact with the positive person, right? And the WHO and PAHO do have definitions for that as well, which we can get to a bit after. And it's not just working out, well, John has been around Carol and Philip and Henry. You also have to find out what level of risk that interaction was. So when John was around Henry, were they wearing masks? What sort of masks? What were they doing? What was the location? What was the activity? And that can also determine whether somebody is a primary contact and whether they need to do things like get tested or quarantine and so on. And that is also very important later on. The other thing we start to look at is try to identify as soon as we can who secondary contacts might be. So secondary contacts would be people who are contacts of the primary contacts. So maybe Henry was a primary contact because he was working with John close in the office and they weren't wearing masks. Henry's brother, who happens to live in the same house as Henry, would be a secondary contact, right? And any of Henry's brother's friends might be tertiary contacts, and you go on and on like that. At the beginning, obviously, we are only really concerned about the primary contacts because those are the people who would need to be quarantined, and those are the people who would need to be tested. The tracing also involves a day-to-day, ball-by-ball, play-by-play as to what the person has done. So again, depending on the illness, you're going back, and how far you go back depends on the illness and the circumstance. So for COVID, you're talking going back 10, 14 days, unless the person is a traveler, in which you only go back to the day that they arrived. And you just go back bit by bit. Such and such a day, What did you do? You got up, you did this, you did that, you went here, you went there. And each time you work out where they've been or what they've done, you again try to assess what sort of interaction there's been. And I know that some questions might be coming to Dr. Best with regards to businesses, but that's where it then becomes important as to whether a business should close or not close. Because somebody might work somewhere, but they might not interact with all the people who work there, right? Somebody might work upstairs and only in the time that was important interacted with 3 employees, meaning that all the other employees are secondary contacts or tertiary contacts. And it's only really then the primary contacts who would need to quarantine and get tested. And then depending on your business might be able to stay open and function without those primary contacts being present, right? And not necessarily have to blanket close down. So contact tracing is very important as well in that sense. It can be difficult because, as I said, you have to jog people's memories, depending on how far back you go. People tend to remember things in spurts. Today they tell you, oh, yesterday I didn't go anywhere, I just stayed home. And then a little while later, then they come and say, oh, oops, I forgot, I actually went to the shop, or I went to the gas station. Or they say I went a particular place and I interacted with no one. I had on my mask the whole time and so on. And then a little later, they remember that they saw a friend that they hadn't seen since school days. And they told them hello and gave them a hug, or some story like that then comes up, which can make contact tracing difficult. One of the things that also makes it challenging is occasionally you get individuals who, it's not a lack of memory, but it's that you have individuals who might not want to be forthcoming with the truth. Sometimes people are not supposed to be certain places, right? Because of work and other reasons. And they might try to hold it back, right? We had this issue with the bus crawl. One of the individuals who was involved in the bus crawl, for example, initially had told mentioned nothing about it whatsoever to the persons doing the contact trace at first. And as we would tend to say, then sometimes little birdies tell you things. And somebody then pinpointed that this person was there. And then when they were asked again, then they freed up the information. Early in Barbados' journey with COVID, we had a gentleman who had a paramour that that his family didn't approve of, and he insisted that he had not been around anybody. And it was only again by diligent contact tracing that one of the contact tracers kept hearing a name pop up. And when they called the person, she then let it all out. And in the end, that person was positive, and that person was actually the source from that guy's COVID infection. So contact tracing can be difficult, it can be challenging. It can be rewarding when you get all the numbers and everything seems to fit together and you can link clusters and so on. I think I will pause and stop at this point because I think I've been talking for a while now, and see if Ambassador Thompson has any more questions on contact tracing in that regard.
Thank you, Dr. Ward. That was really very interesting, and I think it clarified a lot of questions that people will have, and I'm not going to ask you any directly. We have a full suite of media reps this evening, and I'm going to wait on them to ask you the questions. Closing this session, before we turn over to the media, will be Dr. Anton Best, Public Health Specialist in the Ministry of Health and Wellness. Dr. Best, we've heard from the Minister and we've heard about contact tracing, and in the last few weeks we've heard a number of business spaces close. We've heard that an employee at a particular place has become ill, and therefore what I'd like you to guide the public on is exactly some of the issues that Dr. Ward started to explore with us. What happens when there is a positive case at a business place? Does this warrant shutting down? What do other co-employees, co-workers, what should they do? How nervous should they be? How do families living in close contact react when, there is somebody who in the family who may have tested positive, and give us some general guidance on how we need to conduct ourselves now that there are likely to be more people within the community setting and within families who are showing positive. So thank you so much for being with us, and we look forward to hearing from you.
Sure. Good evening, everyone. Thank you, Ambassador Thompson, for the opportunity to say a few words on what business places should do in the COVID environment. I want to remind persons that at the start of the national COVID response, very early on, the Ministry of Health and Wellness recognized the need for guidelines and protocols to guide how the business sector should operate. So in saying, we developed, for instance, guidelines for the construction industry, for the food establishments, for bars and places of entertainment. We also developed cleaning protocols, and other industries were covered under the emergency management protocols. We didn't think that there was a need to be specific for all of the industries, because what we realized is that the basic tenets of prevention of COVID essentially would have cut across all of the industries. So the basic tenets are the temperature checks that we are familiar with upon entering a business, customer logs for contact tracing, where you write your name, email address in some cases, and telephone number when you're entering restaurants, for instance. And then the very powerful but very simple message of hands, face, and space. One simple phrase, 3 powerful words. Hands, good hand hygiene is critical. Face, must always wear a face mask. And space, physical distancing and social distancing. And this is a message that we're not going to ever get tired of saying, and we should never get tired of hearing it, because this is critical to the prevention and control of COVID-19 in Barbados. So, as Dr. Ward would have described, the Ministry of Health and Wellness has a very systematic approach to contact tracing. And here's where his presentation dovetails into my very brief talk on what business places should do in the event that there's a case of COVID-19 that enters that business, whether it's an employee or whether it's a customer. And Dr. Ward would have explained the importance of differentiating between primary contacts and secondary contacts. And this is very important, because what we saw happening was that a lot of people were reacting based on being a secondary contact and then going off and getting tested or quarantining, and not under the guidance of the Ministry of Health and the public health officials who would have identified the primary contacts. And just to remind you what Dr. Ward said about them, those primary contacts, once identified, are quarantined and tested for COVID. So the key message here is that prevention is absolutely critical. But I also need to stress that panic is what we want to avoid. We also want to avoid automatic closure of businesses, and we also want to avoid the notion that all employees in a business need to be tested. Everything that is done needs to be guided by the Ministry of Health protocols and our approach to contact tracing. I also need to remind persons that there's a risk to employees in a business and there's a risk to customers. The risk from customers is relatively low, and I say that because customers come into a business for only a brief period of time and they leave. One of the things I don't think Dr. Ward got into details when he was talking about a primary contact is that a primary contact is defined by space, so within a 6-foot radius, and time. And usually it's 15 minutes or more for someone to be determined to be a primary contact in the absence of wearing a mask. So if you think about it, in a business place, the persons who are there for the longest are actually the employees of the business. So when we talk about the strategies that govern a business place in terms of COVID prevention, Yes, we focus a lot on the customers, but we also have to focus on what the employees do. And there's another dimension to what employees do, and that other dimension is what happens before they come to work, what happens when they leave, what happens when they return to the community. And that is why it's important that all of us remind ourselves of the key actions to prevent the spread of COVID-19. It's not just what happens when you're in a business, it's what happens when you're doing all other activities, whether you're at work or doing other activities. And once again, that very simple phrase, 3 words, hands, face, and space. Good hand hygiene, wear a face mask, and physical or social distancing, imperative in breaking transmission.
Thank you very much, Dr. Best, particularly in defining that issue of the primary contact and what the criteria are. No mask, contact and exposure 15 minutes or more, and standing under 6 feet from the person. So thank you very much for giving that guidance. Dr. Best was our last presenter for this evening. We now have members of the media with us. I think we have a full house. Let me welcome, therefore, Ryan Broom of CBC, David Ellis of Starcom, Janique Belgrave of The Advocate, Colville Mounsey of The Nation, Ian Bourne of Bajan Reporter, Anesta Henry of Barbados Today, and Katrina King of Loop News. Ladies and gentlemen of the media, welcome to you, and we will take your questions at this time.
Yes, good evening, Ambassador. My first question with regard to the West Coast, actually, there was an allegation made on social media that there was an area in Speightstown near where the fire was, where it is claimed that a large number of visitors are congregating and they're not necessarily observing the correct protocols. I didn't know if the COVID unit was in fact aware of this, and if it is, what they intend to be proceeding with. And the other thing related to social media was the fact that there was a photograph of one of the bracelets that was supposed to be used for contact tracing. It had on a blue light. I wanted to find out and verify the significance of that. There were suggestions that the blue light meant that the person had tested negative, but that's a rumor mill, and I've come here for facts.
Dr. Best, are you going to take that one, please?
Thank you for the question. We are aware of the challenges that were articulated in social media postings. I saw that just a few hours ago. The first question was about what do you do when you identify people that are not adhering to the protocols that the government has put out. So you have many options. You have the COVID hotline. You also have the COVID monitoring unit. And the COVID monitoring unit, once aware, is mobilized and investigates all complaints, all legitimate complaints, to determine what actions are required. Ian, you would have also mentioned about the issue of the bracelet for somebody as part of contact tracing. So those bracelets are actually put on persons who are traveling into Barbados to monitor them, and they're geotagged bracelets. And when I say geotagged, here's what I mean. So when a person is in quarantine at a particular hotel or quarantine facility, well, a particular hotel, in most instances, they have this bracelet on, and the bracelet is tagged that once you leave the perimeters, a certain radius of that property, there's an alert that is sent to the Ministry of Health, and the Ministry of Health is activated to investigate why has this person left quarantine. A discarded bracelet actually could indicate that the person has legitimately left quarantine and discarded the bracelets. The bracelets are one-time use only devices. So what do we do when somebody ends quarantine? The bracelet is deactivated, and we ask the person who is wearing the bracelet to simply cut it off and discard it. So I pretty much believe that that is what happened. We have had reports of people seeing discarded bracelets and not understanding that that is what is supposed to happen when somebody finishes quarantine.
So that means that they be thrown away properly rather than just be randomly discarded.
So Ian, you don't actually know how it was discarded. what we know is that somebody saw a bracelet.
Good evening. It's David Ellis from Voice of Barbados. Um, Protecting people from their own families is far more challenging than putting protocols in place in business places in Barbados. The question is, what is the government really considering since we have reached this stage of community spread, community transmission, as you call it? And where does a lockdown feature in this?
Mr. Ellis, that is a policy question, and Minister Bostic will take that one.
Thank you, Mr. Ellis, for your questions. The question in relation to families and so on, that is a very interesting one because that is one that we cannot determine through protocols. That is where we have to appeal to people to be able to help us to deal with that issue. And for example, what we've noticed over the last few weeks is that there are persons who are presenting to a medical facility at a stage which we would consider to be an advanced stage of displaying symptoms. And those persons would have been at home with family members. The appeal from me is for persons, especially if you are living with family members who are elderly, but family members in general. If you know that you have been exposed because of places you visit, places you frequent, then the appeal is for persons to try to protect their own families first and foremost. And that is an appeal that cannot be put into a protocol. The other side of it is that there are persons who we believe may not be presenting early because of a fear of going into an isolation facility. The problem with that is this. If you love your loved ones, your families, and so forth, it is best that we get to them at an early enough stage that we can treat them at the facility and that we can help them to continue with their lives after COVID. The Harrison Point... Sorry?
Why not a lockdown?
No, I was answering that question first. I will answer the question on the lockdown. As I have said earlier, we believe, and we have always said, that we will tighten restrictions as required. And that process started, for example, with the curfew, which was from 6 p.m. and then extended to 9 p.m. And there will be further tightening. There will be further tightening, but that is a decision that will be taken in consultation with the wider social partnership, and that will be communicated in the coming days by the Prime Minister. But at this point in time, we are focusing, we've made some recommendations in terms of tightening up, but we are focusing at this point in trying to deal with what is before us, which is to try to identify those persons who are infected or who have symptoms in particular, to try to treat to them at an early stage and to increase the capacity for everything that we are doing in accordance with the plan that we have based on where we are at this point in time.
I have one more question for you on this, if I can. It has to do with your assurances. You have been giving us assurances since March last year. You had some initial success. But you talked to us about a plan today. To many people, your plan has failed to stop community spread. So in those circumstances, why should we have confidence in your word now?
My answer to that, David, is this. We have a lot of laws in this country. But the reason why we have courts and we have prisons is because not everyone follows the law. I am stating here clearly that the protocols that have been established in this country, and it was not early success. We've had success for several months. And the success that we've had, first of all, is a result of the protocols that we've established. the cooperation of all of Barbados, including citizens. Also, the support from the media, because the media during that period of time played a significant role in terms of speaking to Barbadians, educating Barbadians, and telling Barbadians what they're supposed to do in relation to the protocols. This is not an effort for the ministry that I have responsibility for alone. It is not for the government alone. This is for all of us. And I am absolutely certain that if we put our heads together and we do the things that we were doing before, there have been some challenges, yes, and we've tried to deal with those because obviously, as I said, not everyone followed the protocols. But at the end of the day, it's not about the plan, it's about all of us working the plan.
Yes, good afternoon, Minister. Colvin Munzi, Nation News. Just two questions from me. Firstly, you sent out, the ministry sent out a press release this morning outlining 10 cases at the QUH. Could you outline for me the additional pressure that now places on that primary facility, health facility? And secondly, in your mapping of cases, could you give us a broad perspective of how many constituencies have been touched, or if there are any areas that have not been touched from this current outbreak?
The QEH question, thanks for both of your questions. The situation at the Queen Elizabeth Hospital is that there have been some sporadic cases of members of staff of the QEH. And I say sporadic because there are several departments, as you would appreciate, within the Queen Elizabeth Hospital. And these persons that have tested positive, the 10 persons, are not identified with one or two departments within the QEH, but they touch a number of departments. And in that sense, the impact on the delivery of services in those departments have not been impacted in a negative way by those persons who have tested positive. I would also add that the evidence at this point, the evidence does not suggest that these cases originated within the QEH, but is part of the community spread based on other cases that we have been following. The Queen Elizabeth Hospital is still in a position to provide the services that it has to provide. Obviously, there will be some concern there because some staff have been impacted and staff have been impacted in other institutions. But it does not stop the QEH from fulfilling its mandate. The QEH is prepared for several types of emergency situations, including hurricanes and devastating hurricanes, and how they will reconfigure in a situation like that when they don't have the full staff complement available to the QEH. At this point in time, it is nowhere near that. The other thing that you mentioned, could you please remind me?
That would have been about the mapping in terms of how many constituencies.
Yes, I would have indicated. Yes, I would have indicated previously, and I believe I said earlier today that what we are seeing is that the cases, there's a spread of cases, particularly in the southern part of the country, and as well as the west coast area of the country. The southern part of the country, that is where we are seeing the majority of cases, but there are cases in other parts as well in the north. We would have spoken, for example, to cases coming from St. Lucie. There would have been cases in St. Peter, but the numbers that we are seeing are predominantly in the southern part of the country and the western part of the country.
Okay. Broom, you want to go ahead?
Oh, you go, sir. You go.
Okay, no problem. I have a question for Minister Abrams. Minister.
Go ahead.
Yes, Minister Abrams. I'm not sure if I heard you correctly when you said that you had 99 sick certificates. Is that correct?
99 officers reporting on sick leave at present.
Okay. Now, what I'm trying to ascertain, what type of pressure does that put on the facility in terms of returning to normalcy, in terms of freeing up the resources of the BDF and the police that were up there helping out with the situation? And also, in terms of these sick leaves, is it a case of some sort of fear or industrial action we are seeing?
Colville, let me start with the last thing first. I don't look behind a doctor's signature. I believe that a sick certificate is exactly that until it is proven otherwise. So if someone comes out of quarantine and is declared healthy and fit to leave quarantine and leaves quarantine today and sends in a sick certificate tomorrow, I have to accept that as what it is, that something else is wrong with them. You know what, I give you the lines you read between it. Now, with respect to what pressure is put on the institution, if we have a staff complement of about 350 odd persons and 99, let's call it 100 because it's an easier number to deal with, and 100 are sick, that is almost 1/3 of our workforce. So what it does do, it puts incredible pressure on the other officers who have to pick up the slack, some of whom came out of quarantine, some of whom came out of isolation and reported back to work. So we're now down to a situation where there are essential services only at the prison. So when people ask, why is it that we can resume the virtual visits? Why is it we can do a number of the other things that we did before? We actually don't have the staff to be able to manage a lot of those. So the BDF has stepped up to the plate. And as I said, I thank the Chief of Staff and his soldiers for stepping up to the plate, and the police as well. And they have helped to patch the holes or to supplement the depleted shifts. But we're trying to not use the BDF officers and the police officers in essential prison situations. So we don't necessarily want them interacting with the inmates where it can be avoided. So they do perimeter security, other things that don't really involve trained prison officer duties. So our ability to return to normal is governed by two things. It's governed by our management of the COVID situation in the prison now and our still going with the protocols that have served us well in this stead and helped to reduce our numbers. So we're managing the situation as carefully as we can. But the other thing that's hamstringing us in coming back to normal is the shortage of officers. There's no getting away from that. So, as I said, I wish everybody is sick a speedy recovery, and I look forward to when we have approaching a full complement back. I believe that come next week, the complement should increase. It's been steadily increasing as people recover. I look forward to us having a near full complement so that we can start to put back some of the activities that eases some of the stress on the officers who are there and also on the inmates. It is not easy being in a prison situation in a time like this, and the inmates in custody, they want to be able to speak to their family. They want to be able to do some of the things that give them an almost normal life while still serving their sentence, and a lot of that is conditional on our complement improving. But as I said, we're doing the best that we can with the circumstances and staff complement that we have now.
Good evening, Ryan Broom here from CBC. Question is for Minister Bostic. Minister Bostic, given what you said in terms of some tightening of the measures that we can expect, I know you said that a meeting has to take place in terms of the wider social partnership, but are you looking at yet at a particular timeline when that could happen? And I guess we're thinking about things like probably extension of curfew, perhaps even alphabet system. I'm not just throwing those out there, but potentially those things. Are you looking yet at the timeline? That's the first question. And second question is, in your contact tracing, have you definitively linked any of the original positive cases, what the doctors would call the index cases, to quarantine breakers? And if so, how many of them?
Well, let me deal with this. Thank you very much for the questions. Well, let me deal with the second question first. I'm not sure what you mean by index case. If you're talking about that one case that people have been referring to.
The person who the infection would have originally come from, in terms of any of the clusters.
Oh, that, yeah, no, we've been able to make linkages. There's no question at all about that. So that I would have said on a previous conference that we were able to determine that this matter would have originated on the West Coast, and then it went to other institutions like the prison, the bus crawl, and so on. So, and that there were 2 persons, for example, from the West Coast cluster who had interacted with about 25 or 30 of the positive cases that were spread throughout other groupings. So clearly, there are links that have been made. The link that we have not been able to make is where it started from the index case, which is the person who would have started this process. Okay, and your first question, you would understand and appreciate that I'm the Minister of Health and Wellness, and that there's some of the measures that are not only related to health and wellness, but there are other ministries that are involved, and certainly at the level of the social partnership, there's some consultations that have to take place, and I am not in a position to give you a time frame, but what I can say is that, of course, given the situation that we're facing at the moment, that there's some tightening up that is required from next week, but those matters will be discussed.
Minister Bostic, declaring community spread, can you spell out what that really means? What would be required of the government of Barbados in these circumstances, having taken the decision to communicate to the World Health Organization that we have community spread?
Right. The first thing, thanks for the question. The first thing is that by declaring community spread or community transmission, it actually puts us in a position for greater assistance from those bodies. That's the first thing I will say. In terms at the local level, we recognizing that there is community spread, and based on everything that we've been doing up to this point in terms of dealing with cases in various parts of the country, we have determined, and I would have mentioned some of the measures that we have taken and that we are going to take. But I will say, also remember, I would have indicated that we now have to allocate more resources to contact tracing, and that we have to focus on some particular areas that we consider to be of greater interest in terms of our contact tracing. I would have indicated the need for us now, especially to be able to identify persons who are displaying symptoms so that we can get to them early, test them, and if they're positive, start the period of treatment. I would have indicated the integrative approach in terms of the use of the rapid antigen test for screening, not only in hospitals, not only in our clinics, but with even private sector entities as well, because that is very, very important. So those are some of the steps that I would have said that we were going to be taking. I would also have said that there was always a plan in place for this eventuality, even though we were hoping that it would never happen. So that plan is being assessed, because that plan would have been done early back in 2021. But we now have some experience that we could bring to bear on the situation so that we'll fine-tune that plan. We intend to share that plan with the Barbados Association of Medical Practitioners and other stakeholders. And there are some aspects of that plan that we will have to start looking at getting things in place in case we have to activate. And that includes the standing up of additional facilities. Blackman Gollop was only one. But there are other facilities that we have, and we have plan B, C, D, and E, because we never knew exactly what was going to happen. And so we had to put things in place, and we try to worst case everything that comes our way.
Critics are telling me that your contact tracing method is a bit antiquated. They suggest that you should be having QR codes, and there are those who say that the government is behind the ball in this regard. If you're going to step up contact tracing, wouldn't it be necessary to improve the technology that you're using? People point out that we are still, and many of us go places, people are still using pen and paper to take your name and your number.
Thank you, and I would say that is a fair comment. And only today, contact tracing is really for the public health officials, but I will speak to this in the sense that that matter was raised today at a meeting with BAM, and they actually had a suggestion, something that they wanted to put on the table, and I indicated to them that they should deal directly with the medical personnel responsible for contact tracing, and if as early as Monday there's a solution, a technical solution out there that can assist in the process, we'll be very, very happy to look at it, because if there's such a thing out there that is available in Barbados, there's no reason why we would not want to look at it.
I would like to follow up on my colleague, Mr. Ellis, Minister. I have been getting people bombarding me, some saying 11 days, some saying 19 days. They have no receipt or, as Mr. Ellis pointed out, a QR code that they have taken a test. You also spoke to the fact that there's going to be rapid antigen testing. Best Dos Santos can only do so much. Is there a likelihood that the possibility of using the University of West Indies to take up the slack of tests in addition to Best Dos Santos, and what can be done to provide, as I said, a receipt or a QR code for those who were tested?
Yeah, the last question, that is already in train. Not necessarily QR code, but certainly an email to start with, and then we've been sending things directly to persons from the doctors or the testing sites for those persons who were swabbed in those institutions or facilities. The capacity, and I don't want you to mix up the antigen test with the PCR test, because the antigen rapid test does not require any work inside the Best Dos Santos lab. But the PCR test, we don't have an issue in terms of the capacity, the capacity to test or the capacity to provide PCR tests. The lab has went from doing 200, 300, 500 tests to up to 2,000 tests per day, PCR tests. So the issue was not the lab being able to do tests. In addition to that, you would recall that the Prime Minister would have indicated that we are looking, there are two private entities that have made submissions in terms of establishing testing capacity, additional testing capacities, and we are looking at those as well favorably, because if we can have some additional capacity on the island, of course it will help.
Mr. Minister, two questions from me in terms of, firstly, your transient population, the homeless persons. Now that you have announced that there is community spread, that raises some some concern among that population. And also, I know I sound a bit like a stock record, keep asking this question every time we have a press conference, but in terms of the variant, what the investigations into that, how far are we where that is concerned?
As we would have indicated, the samples have been sent to the Caribbean Public Health Laboratory in Trinidad and Tobago, and the officials at the Best Dos Santos lab, as well as the Chief Medical Officer, are in contact with the officials at CARFA, and I believe that we will get some information in the coming days in relation to that, but I don't have any information on it at the moment, but we've done what was required of us, and we've submitted the samples. Remember, there would be a queue at the lab, the CARFA lab, because CARFA is not only dealing with Barbados, but the region, but we are trying desperately to get back those results as quickly as we can. But also, you would recall that I also indicated to you that whether or not the variant is here, and I'm not saying that we don't want to know, we obviously do. But what we are trying to do in terms of the protocols and protecting ourselves and following the public health advice, that remains in place irrespective of what variant comes our way at this point in time.
Minister Bostic, you say we need to have that information, but it does appear as though we dragged our feet nonetheless. In the same way that the World Health Organization needs to know whether we have community spread. isn't it important that they should also know whether one or other of the variants is present in Barbados?
Of course, yes, yes, it's important for them, it's important for us. In terms of your statement in relation to drag, I would say that I wish we were able to get the samples there quicker. There was a process that had to be followed, memorandum of understanding and so forth, and I wish we could have gotten the samples to CARFA sooner. But we were not able to do so, and at this point they are with CARFA, and we are hoping that we'll be able to get back the results as soon as possible.
And doesn't that constitute a serious lapse? Given the high contagion effect of these variants, wouldn't it be very important that we corrected any situation that stopped us from getting these tests to the lab much sooner? We believe that we started hearing about this about 2, 3 weeks ago. That's a long time. And as Barbadians tell you, while the grass is growing, the horse is starving. Look at what has happened here now. We are talking about community spread and families being insecure.
Thank you again for your concern and your question, but I would remind you that there are countries that have had community spread on more than one occasion without the variant. So I don't know if there's an attempt to link the community spread with the variant. I'm not sure if that is what you are suggesting, but I'm just pointing out that there are several examples. We all watch the news. There are several examples where countries have had surges, community spread, interstate spread, all kinds of spread before this variant was announced. And also the fact that the variant was around from as early as September last year. If you want to say that we should have gotten the samples to CARFA sooner, okay. I'm not going to sit here and tell you that everything has been done or we've been able to do everything perfectly. But what I can say is that we've tried our best to deal with what we have been facing here in this country, regardless of whether or not it's the variant, which is that we're trying to get to people, to treat people. We're trying to do the testing and the tracing, but it is a collective and a collaborative effort. That is
Mr. Minister, you didn't respond to the question about the homeless population, the transient population, given the current vulnerable state, given the news of this community spread.
The community spread in this country, it's not community spread, or the virus is no respect of any group of any persons. We have to take care of every single person on this rock and every single group. And the measures that we are undertaking and what we've been doing over the last several months really is for everyone on the island, everyone. And that includes who you refer to as the vagrants. All I'm saying is that there's no special thing to any group except vulnerable groups, for example, like the elderly and those with comorbidities, which we were advised from early in the game last year that we needed to take care of. And that's why we introduced restriction on visits from early in 2021 to our seniors' homes and so forth. But we treat everyone the same, and all persons in Barbados, that's the responsibility of the Ministry of Health and Wellness.
Theoretically, what my colleague, Mr. Mounsey, is speaking about, it could be the improper disposal of disposable masks. There is a new trend now where it is suggested that it is better for people to use disposable masks, but those incur an expense. When those masks are thrown away, a homeless person could be trying to recycle it because they have no other option. It is really, while it might appear that a cloth mask has certain risks, it has an inherent factor in that is what a person can afford. They would rather wash a cloth mask. Are there any steps by government going forward, especially being that we have what WHO calls community transmission, to make disposable masks more affordable and to have better facilities for getting rid of those masks, because there are people now who are starting to wash disposable masks rather than get rid of them properly.
Yeah, I don't know if one of the public health officers would want to take this up, but from my perspective, I'm not aware of this trend that you are referring to, but certainly it's something that I can look into, and thanks for raising it. I'm not sure if it is an issue. I don't know if one of the public health officers would wish.
Thank you, Ian, for your question. I just wanted to say a word about masks and the government policy overall. From April of 2020, the government of Barbados recommended the use of face coverings. And what we in the Ministry of Health, we try to impress upon the wider government and others is that we were recommending face coverings because they were effective. But what we did not want to see was people using medical masks. You have to appreciate at the time there was a sudden high surge in demand for the use of disposable masks, which are usually medical masks, and we wanted to stay away from that. We wanted to reserve supplies of medical masks and disposable masks for the healthcare facilities, whether it's the Queen Elizabeth Hospital, the polyclinics, and the private healthcare facilities. The issue that you raise is a bit odd because I've never heard it as an issue, but it's certainly something that we can take back at the Ministry of Health and discuss in terms of the disposal of masks, proper disposal of masks, because based on what you're saying, people are reusing these masks, the persons who are homeless that have access to masks that are disposed. We would not want to encourage persons to reuse disposable masks. Certainly the only masks that should be reused are the fabric masks or cloth masks, because they can be washed, they can be sanitized, and they can be reused safely and continue to be effective. But certainly if you're reusing the face mask, the disposable masks, the efficacy or the effectiveness of them at preventing COVID-19 transmission deteriorates because they're not designed for reuse.
I have a question for the Home Affairs Minister. This has to do with certain complaints which some people who are associated with the prison have been drawing to our attention. You see, inmates have been complaining about a lack of medication, that they don't have enough sanitizers. They're requesting medication and vitamin C to boost their immune system. And basically, they are not as satisfied with the situation that obtains. There are many Barbadians who feel that once you're in jail, whatever you get, you deserve. But there are others who suggest that nevertheless, many of them are innocent until proven guilty, and even after they have been proven guilty, there's a certain way that they need to be treated. How do you address those complaints, Minister?
David, thank you so much for that question. Let me start by saying the health care for the inmates at the prison has not been compromised at all. It is a front burner priority for me. We get reports on what is going on with respect to access to medicine, even food. We get daily reports, at least once a day, of what the inmates are being fed, when they have been fed, who has requested access to information to a doctor, to medication to a doctor or whatnot. So we had a situation where the pharmacy at the prison was closed for a couple of days because I believe the pharmacist was not able to come. The pharmacist was not well. And we made arrangements to get the medication from the QEH, and we also made arrangements to get medication from private pharmacies to address the concern of those inmates. Now, with respect to the vitamins, we had a difficulty with that because the vitamins are normally, and supplements like vitamin C and whatnot, are normally available from the commissary. So inmates, if they want to take certain vitamins, when their relatives put money in their account, they will purchase them from the commissary. But the commissary was closed because we reduced it to essential services only. But when that issue was raised by the inmates, I immediately gave the instruction, and the vitamin C and whatnot was sourced from privately and distributed to the inmates who requested it. So every single time we had a complaint or a query like that, we addressed it immediately. But what ended up happening is somebody may have circulated something today saying, you know, my son, my daughter was not well or feeling sniffly and they couldn't get vitamin C. And we addressed it immediately today, but that same message is still circulating 7-8 days later, and people think it's a current state of affairs. The fact, David, that we've been able to reduce the infection rate in the prison to where it is now, that we've had no serious cases, would tell you or hearken to the point that every single issue with respect to the inmates that we received notification on, we addressed as quickly as the notification came, and we did not play with the health of the inmates. I mean, I don't want anybody to die on my watch, right? I was a lawyer. I have been a lawyer for 25 years. So my concern for inmates doesn't just come from my position as Minister of Home Affairs. It came from my 4 years fighting for the rights of those exact same mistakes. Every time a lawyer called me with respect to the condition of one of their clients, or somebody called me with respect to the condition of their brother or sister, I immediately, not put it down for later, I immediately forwarded that complaint onto the superintendent of prison, or when it was Major Provost in operational control, to him, and demanded an immediate response. In most instances, the inmates that people were concerned about were put on the phone to speak to them to say, well, you know, I'm okay, or this has been done, and that matter was allayed. But it's sometimes we just kept running behind the fake news that was circulating for long periods of time that purported to raise issues that were addressed 5, 6, 7, 8 days before. So all complaints with respect to the inmates' comfort, with respect to their feeding, with respect to their access to the lawyers, with respect even to their being able to call home or get messages, were addressed immediately as they were received. I am comfortable in saying that nobody's health care was compromised, and we took every single report seriously. And that is borne out in the fact that we've been able to bring the rate of infection down, and we actually don't even have any significant concerns of inmate discomfort or general illness, let alone COVID. So we have gotten those, we've addressed them as they came up with no delay at all.
Many people who
Minister Bostic.
Sorry. Go ahead with the question.
Okay, Anesta Henry Barbados today. Minister Bostic, it has been brought to our attention that a staff member in the St. Lucie District Hospital, which is currently housed at the psychiatric hospital, has tested positive for COVID. What can you say about that, including the implications for the rest of the staff?
Thanks for the question. Yes, it is true that a member of staff at the psychiatric hospital has tested positive. And we follow the same procedures that we've been following all along, which is to quarantine any such person or case. We take particular interest, obviously, within a hospital setting of any kind, for obvious reasons. We isolate those persons and we do the contact tracing that is necessary. We've done it on another occasion within the same psychiatric hospital, and it has happened at other hospitals as well. But on most of the occasions, none of the persons who we consider to have been primary contacts within the institutions have tested positive. And at this point in time, all efforts are being made to make sure that we safeguard the population there, and that is really what we are doing at this point in time. But the answer is yes, but we are following the normal procedures and doing what has to be done.
I have a question.
Okay, we are also receiving information that more than 50 police officers are under quarantine, including the interrogating unit. Do you know this? Can you give us any information, please?
No, I honestly do not know about that. I can tell you that we know that there have been some police officers who have tested positive, and we've taken care of those cases through the same contact tracing and so on. And members of staff at some of the stations have returned to work. Whoever tested positive, those persons have been placed in isolation, but I do not have the answer for the question directly that you're asking me because I'm unaware at this time.
Is there anyone who can answer the question, please?
Thank you very much. We've been going for about an hour and a half now. I know that Dr. Ward has some information that he wants to share with us, something that will help to tighten and improve our contact tracing and to give some suggestions to members of the public. So we're going to ask Dr. Ward to speak to that matter, please. I think we have not yet heard from Loop News or the Advocate, and I wouldn't want to close before we give these two media houses an opportunity to speak. I see that there is a lot very keen interest, and therefore it means we're going to have to probably come back with another press conference very early on Monday. When I say very early, on Monday, or maybe on Tuesday, so that we can follow up with this level of interest. But in the interim, Dr. Ward, if you would be kind enough, please, to indicate, share with us the suggestions that you have.
Okay. So just had some suggestions or some things I wanted to bring out to the public as well with regards to assisting us with contact tracing. First of all, if you are someone who's been notified as a primary contact and you go into quarantine waiting to get your after exposure test, sometimes you might be asked to get it immediately. Sometimes you might be asked to get it 5 days following your contact with the positive person. And on some occasions, when we're trying to work out clusters as quickly as possible, you might be asked to do both. But when you are in that position, one of the things I would like you to do is start working from that day and going backwards and start getting your play-by-play together. Where have you been? What have you done? Who you went by? All of that sort of stuff. Where did you shop? All those sort of things. And you're going to need to start to put that together. Because what happens then is later on, if you do test positive, God forbid, but if you do test positive, when the contact tracing team calls you, it's easier to get your information together. Sorry, getting a little feedback. Right, so later on, if you do test positive and we then have to start asking you questions, you have some of that already to hand. It also I've also found in contact tracing, it makes it more helpful. You tend to forget less. And if you have your running commentary on where you've been being put together, as you remember things, then you can actually go and fill them in. One of the other things that's important or can be very useful technologically, we had someone ask a question about technology earlier, and that is that individuals who have their phone location settings on, particularly if you have an Android phone, you can go in and turn on your Google timeline. If your Google timeline is already on, then that's great. If it's not, you can turn it on. What happens is with that, then you can actually go and map back. Google will show you where you've been for the past 2 weeks, right? Now, obviously, some people are very concerned about Google knowing those things, but they probably know anyway. So I'm just saying, but I suspect they already know anyway. So I think it's actually very useful because sometimes when individuals who have the timeline on and you're able to work with them, sometimes the timeline has in places that they actually forgot that they went, right? So that's something else that can be very, very useful with contact tracing. Just wanted to add another thing to let people know that the contact tracers in Barbados are working extremely hard right now. There's nothing called bank holidays and weekends for the contact tracing team. We're up late hours doing work and reviewing result sheets and trying to find out who we have to call next. Sometimes the only thing that stops us is not calling people at ungodly hours, right? And I think those are the key things I wanted to mention so people can help us. I also don't want to necessarily promote people being malicious and getting in people's business, but it also has been useful as people come forward and give us information as well, just as people give COVID hotline information and so on. But as I said, not that I want to create peepers and so on in the country, but it is useful when we can get third-party information as well. Thank you.
Thank you very much, Dr. Ward. Ms. Henry, we have recorded the question and we will try to get an answer to you directly at Barbados Today. I believe that our press people here would have your contact information, so we will try to get the answer directly to you because it is an important question. That just leaves us with Loop News.
Jane Baldwin, Barbados Advocate.
Yes.
Hi, I was wondering if it's possible to get an update on the clearance of the backlog of the test results, what percentage by now has been cleared, as well as before persons who were coming here for surgery could have applied for exemptions in the past with regards to quarantining. Is that still the case?
All right, Dr. Bess, thank you for that question. Dr. Bess, you're up. Sure. Thanks.
So regarding persons who are coming here for surgeries, there was never any exemption given for quarantine. What we do permit in some circumstances is you can quarantine at a private residence as opposed to a hotel, and then you can leave that residence and go straight to the hospital, whether it was surgery or some other medical intervention. I would now hand over to Minister Bostic regarding the backlog.
Spray, please.
Thank you very much. The backlog that we were referring to, which was just over, I believe, 7,000 samples, that backlog for the most part has been cleared. When I say the most part, I really mean the most part. The only samples that are in the lab from that time period are samples where there is no information that would allow the persons in the lab to be able to do what is required. And I believe that some of those persons might have been reswabbed, and they're not many. We have practically cleared the backlog that existed, and we are trying to keep current in accordance with the timelines and so on that we would have established. And the lab right now is back to some degree of normalcy, I would say. And if you had to go into the lab now, you will not find all of the samples that were there before. So right now, the backlog is an issue that I can say that we have put behind us, except for those few samples that I referred to. And the intent now is for us to keep current going forward, and we've put some measures in place to try to be able to do that. And so far, the tests that have been arriving at the lab, we've been able to get out the tests within time, based on the time that the samples, arrived at the lab.
Dr. Bass, my final question is, can you speak to any long haulers? Are there any patients with long-term complications that you're seeing right now?
I'm perhaps not the best person to respond to that. I do believe you're talking about persons who have been diagnosed with COVID-19, have been admitted to isolation, and are having what I would describe as a protracted period of illness. The best person to ask would be Dr. Corey Ford. So I'm sorry that I'm not able to give you the response that you're looking for.
Minister Bostic, my final question to you is, we are now at community spread. Can you speak to whether we are now looking at mandatory mask wearing? Seeing the fact that, the reality stands that there are some people who are ignoring the fact that authorities are asking them to wear masks.
Thank you. The answer is that is under some active consideration, but obviously that has to be dealt with by others in terms of if making it mandatory, and we have to take into consideration those persons who medically or otherwise have difficulties with wearing masks, and there are some people like that that the Prime Minister would have spoken to. But at this time, right now, I'm asking persons to please wear your mask, but this is going to be included, I believe, in the further restrictions and the measures that will be announced at a later date.
Members of the media, members of the public, thank you very much for joining us this evening. The key actions we're being asked to take at this time is to continue to wear our masks, sanitize or wash our hands frequently, and stand 6 feet away from persons who are not members of our household, and indeed to take certain precautionary measures within our household. I think that there's other information that has emerged that is important for all of us. If we feel unwell, report it early, because we could deteriorate very quickly or infect other family members, other loved ones. Seek help early and tell the truth when you go to the medical practitioners. Thank you so much for joining us. This is an evolving situation. We will continue to keep you fully updated and apprised of what is happening in the country and what measures are being taken to keep Barbados safe. If we work together, Barbados can and will beat back COVID. Good evening to you.